Good morning, guys. I hope we're all sparkly. You may have noticed I've been doing less and less of these videos. I do not have the time or the inclination to be part of the TRT community, whose main aim seems to be promoting testosterone replacement therapy. We should just all give it a go. Make you into the man you should be. No, testosterone deficiency is a medical condition. TRT is a medical therapy. The aim of TRT is to establish normal male androgen levels, not health optimization, because this word has been distorted by the bozos to promote supraphysiological levels for gains. This is not what testosterone replacement therapy is about. It's about establishing normal male androgen levels to help facilitate the primary purpose of testosterone growth and repair, which is involved in this process of homeostasis. Balance, baby. Balance. So, what is the right age to start testosterone replacement therapy? It's a kind of stupid question. You should start testosterone replacement therapy when you need it. When you have explored all avenues of your lifestyle, nutrition and exercise, and looked for reversible causes that would prevent you from needing TRT. Really simple. So, need. Is it based on the qualitative symptoms or lack of qualitative symptoms? So low mood, low libido, lethargy, etc., etc. Or is it the quantitative markers? The total testosterone, free testosterone, estradiol, etc., etc. It should obviously be both. Now, when we think about the qualitative markers, subjectively to the patient, they're obviously incredibly important. They should obviously be incredibly important to the doctor. However, when you approach the NHS, the primary importance is normalizing your male androgen levels. Now, we've already spoken about reference ranges in the past and how they are lowering with time, reflecting a sick society, and they do not take age into consideration. So testosterone levels do drop with age typically. So you can't apply the same standard to a 60-year-old that you can to a 20-year-old, and conversely a 20-year-old to a 60-year-old. But actually, this is an interesting discussion because testosterone levels decrease with age. Why do they decrease with age? You are supposed to die. When we think about hormones, we have a level. So in all systems, we have hyper and hypo. Thyroid, adrenals, diabetes. All of the endocrine system has a high and a low, because in the middle with you is where you will establish balance and you will help facilitate the natural processes that go on within the body. So when testosterone levels drop, should that be considered normal and natural? Well, it is normal and natural, but it does not help facilitate the body's metabolic function and physiological actions. So, should you accept a low testosterone because you're old? That's actually entirely up to you. If you have low testosterone and qualitative symptoms that indicate low testosterone, surely normalizing, and I mean normalizing, your male androgen levels should be positive. So, it is a complicated situation. When you concentrate more on the quantitative markers and you do not have a deeper understanding of the human body as a whole, you can be misled and falsely reassured by having normal male androgen levels. Now, we've spoken about this again before. Type 2 diabetes is a good example of this. What happens in type 2 diabetes? You tend to have a low SHBG. So you have low testosterone, so we'll say 11 nanomoles per litre, and then you'll have a low SHBG, but you've got all the symptoms of low testosterone. Now when you think about the BSSM guidelines, if you've got a testosterone of 11 and symptoms, you should obviously explore free testosterone. Now the free testosterone is unlikely to come back, well, it can do obviously, but it may not come back less than 0.225, which is the cutoff point for a trial of TRT. However, you may have all of these symptoms. So you've got low testosterone, which does indicate the need for a trial of testosterone replacement therapy, but you've explored a little bit further and found the free testosterone means that you do not qualify for TRT because your SHBG is low. Now let's consider this poor guy. He's been struggling for years to lose weight. Now the primary cause of type 2 diabetes is increased body weight, chunky monkeys. So I've tried every diet under the book. I've tried every physical exercise regime I can, and I still can't lose weight. Now, is it chicken or is it egg? Does it really matter? So, low testosterone, lack of drive, lack of determination, increased visceral fat, subcutaneous fat, lack of lean muscle mass, tiredness, and you're supposed to go and tell this patient to lose weight, do more exercise, look at your diet so that you can normalize your male androgen levels. Is that realistic? Well, that's a decision you need to make with your prescribing clinician who understands a little bit more than what it says on the computer. Because we do have to adopt a holistic approach to medicine. And whilst guidelines are incredibly helpful, they're not the be-all and end-all. Now, some companies manipulate the guidelines to justify TRT because they are trying to sell you TRT. I am not trying to sell you TRT. I'm trying to sell you on the concept that normal is best. And you should do everything in your power to increase your testosterone, normalize your male androgen levels, to prevent you from needing TRT. Because guess what? If you go on TRT, you are still gonna have to do this. Now, type 2 diabetes, again, increased adiposity means you will have aromatase in the adiposity, which will mean even with a great testosterone, a great free testosterone, you will have a high estradiol. You will have an increased propensity to aromatization, and you will feel terrible despite having a healthy testosterone and a healthy free testosterone. So you will still have to look at your diet, you will still have to exercise, you will still have to look at your lifestyle, improve your sleep quality to effect a positive change to your long-term physical and psychological well-being. Now, we can temporarily manipulate your estrogen levels with drugs. So if we need to, and I mean need to, microdose examestane. And we don't use 25 milligrams. We use, on average, 1 milligram if necessary. 1 milligram. So when you think about all of these studies that demonstrate harm in aromatase inhibitors, you need to look at, number one, the dosage. You need to look at, number two, the sample population that it applies to. Now, it's typically females with breast cancer who are obese. So it's not really the population to be drawing any significant conclusions from. So there's an absurdity to apply a dogma to medicine when you do not understand medicine and physiology. So do not listen to the bozos. So it's a temporary measure so that you optimize your male androgen levels, bring that ratio of testosterone to estrogen to DHT into a healthy range. It's all about ratios. Testosterone, estradiol, DHT, your anabolic hormones. We raise them, lower them according to effect, because you've got catabolic hormones. Anabolic, catabolic, anabolic, catabolic. So it's all about balance. And this is integral to appreciating the goal of TRT. I want high normal levels, doctor. We will titrate your dose to normalize your melandrin levels. Now, does that mean we'll stop at 0.7 free testosterone? Well, it's not a bad free testosterone, but actually some of my guys do prefer to be a little bit higher. Now, what are the limiting factors? Because we do not encourage super physiological levels, because there are negative health outcomes from having high testosterone. But there's been no studies demonstrating. Shut up. Honestly, balance. It's all about balance. High hematocrit. Yeah, but people on testosterone get high hematocrit. No, they don't. They do not. When you normalize melandrin levels, you normalize your hematocrit, as long as there are no contributing factors such as obstructive sleep apnea. Yeah, but people in high altitude have high hematocrit. Do we all share the same genetics? We've got 23 pairs of chromosomes, but there is genetic variation. Numpties. Athletes, sports anemia, as a result of increased endurance exercise causing increased plasma, because they're carrying the waste products away from the muscles to be excreted by the kidneys. You don't get a corresponding increase in erythrocytosis. So you can't apply those two stupid arguments to the fact that testosterone increases HCT, so it's okay. Increase in red blood cells within a fixed volume increases cardiac demand, increases the chance of hypertension, and increases the chance of cardiovascular disease. It's not rocket science. Your lipid function can become deranged. Low LDL, high LDL, so the protein that takes cholesterol to the cells. Low HDL, that takes cholesterol away from the cells. We don't want that. Give me a break. It is such hard work dealing with these people that are promoting testosterone as a cure-all. Just increase the dose. Where did we get to? So yeah, the limiting factor when it comes to testosterone levels is, are there any negative health outcomes from having high testosterone? Now, they come in two forms. They come in these quantitative markers that we've just discussed, but they also come in the form of psychological distress, or distortion is probably a more appropriate phrase. Now, we all know the bozos on the internet. Lots of drive, lots of determination. We all know bozos in the gym. Good fun for a few minutes, because actually testosterone is integral to drive and determination. And when you've got low testosterone and you've lost your drive, lost your mojo, you want it back. So you want to have high testosterone. You don't want to have high testosterone. You want to have normal testosterone. So those guys with high drive and high determination, they're tolerable for about 5 minutes, 10 minutes. After a while, they start to grate on your nerves. You want to be cool, calm, and considered in all situations. That's what it boils down to. So, when it comes to the question, what is the ideal age to start TRT? It is when you've explored all alternative avenues to prevent you from needing TRT: lifestyle, nutrition, exercise. You've looked at other systems like your thyroid. You've got to show due diligence involved in this. Is an incredibly involved situation. Hormones are incredibly complicated. If you affect one hormone, it has a subsequent cascade effect on other hormones. Thyroid affects the male androgen levels. Prolactin, honestly, the list goes on. You really should not enter into this eyes wide closed. You should enter into this eyes wide open.